Last Breath Diaries, The Woman Who Faded Away, Part 3 of 3. Welcome back to Last Breath Diaries, and thank you for returning for the final part of our 3-part series, The Woman Who Faded Away. In Part 2, we followed Rachel Porter as she faced the terrifying truth of her diagnosis, Addison's disease, a condition that left her body unable to produce the very hormones needed to survive stress. We watched as she collapsed into adrenal crisis, not once but twice, fighting for her life, as doctors worked to stabilize her fragile body. We also saw her begin to rebuild, sharing her journey, finding strength through community, until new symptoms began to creep in. Pain, fatigue, bruising, and weakness that didn't fit the Addison's pattern. Now, as we open Part 3, her trusted physician, Dr. Elijah Warren, suspects something far worse may be brewing beneath the surface. Something rare, even by medical standards. Tonight, we bring you the final chapter of her story, the conclusion to a journey that will test not only science, but faith, love, and the strength of one woman who refused to be forgotten. It's February 2018. Winter in Portland is gray and cold, the kind of damp that clings to your bones. Rachel wakes to the sound of rain tapping softly against the window. Her body aches before she even moves. Her hands are trembling again. She pulls herself to the mirror and stares. The face staring back is pale, hollow. There's a faint blue tinge under her lips, as though the life inside her is dimming just a little more each day. Mark walks in quietly, holding her morning pills. "You look tired," he says gently. She forces a smile. "I'm always tired." He kisses her forehead. "I know, baby, but we'll figure this out." She wants to believe him, but even faith feels heavier now. 2 weeks later, Dr. Warren calls her into his office after hours. The look on his face is heavy, a kind of worry that doctors wear when they're running out of ideas. "Rachel, I've gone through every test we've done so far. Your Addison's is stable, your medications are right, but something else is attacking your system." She frowns. "Attacking?" He nods. "Your immune system is overreacting. It's not just the adrenal glands anymore." Her voice cracks. "So what are you saying?" He exhales slowly. "I think we might be dealing with autoimmune polyglandular syndrome type 2, multiple organs under autoimmune attack. It's rare, maybe 1 in a million." Rachel lets out a shaky laugh. "Of course it is. Why would I be anything normal? Hey, nurse chat. Did you know that autoimmune polyglandular syndrome type 2, or APS2, is when the immune system turns on several of the body's glands at once? It can involve the adrenal glands, thyroid, and even the pancreas, leading to conditions like Addison's disease, Hashimoto's thyroiditis, or type 1 diabetes. It's so rare that most doctors will never diagnose it in their entire careers." Over the next few weeks, Rachel's symptoms evolve again. Her heart rate skyrockets without warning. Her blood sugar crashes. Her skin flushes hot, then turns ghostly pale. She's back in the hospital twice that month. Dehydration, hypotension, unexplained pain. Each time, Dr. Warren adjusts her meds, adds new labs, and sends samples for rare antibody testing. But Rachel feels her body slipping. "I'm doing everything right," she tells him one morning. "I'm taking the meds, eating the salt, drinking the fluids. So why do I still feel like I'm dying?" He sits beside her bed. "Because your body's fighting itself, Rachel. It's not your fault. None of this is your fault." Her eyes fill with tears. "Then whose is it?" There's no answer for that. Not one that would help. By March 2018, the test results finally arrive. Dr. Warren flips through the pages, his hands stilling as his eyes scan the final report. There it is, the marker he feared most, 21 hydroxylase antibodies, definitive for autoimmune Addison's, and new positive antibodies for thyroid peroxidase and GAD65, confirming the diagnosis of APS2. 3 separate organs, all under attack. When he breaks the news to Rachel, she's silent for a long time. "So I'm falling apart from the inside out," she says finally. He swallows hard. "You're not falling apart. We just have more to manage now." Her eyes are tired but steady. "You mean I have more to survive?" Hey, nurse chat. Here's a fact worth remembering. People with Addison's disease and related autoimmune syndromes are at constant risk of adrenal crisis, especially if another autoimmune disease develops. Every infection, fever, or emotional trauma must be taken seriously, because even a small stressor can become deadly when your adrenal glands can't respond. For the next few months, Rachel's life becomes a rotation of doctor visits, lab work, and medication changes. Her pill box grows heavier. Steroids, thyroid replacement, electrolyte tablets, and new supplements to keep her blood sugar from crashing. She tries to stay positive. She posts updates online. Open quote, "Still fighting, still here, still breathing," close quote. But the fight is exhausting. There are nights she cries in the dark, afraid to sleep, afraid her heart might forget to beat. Mark holds her, whispering, "You've survived worse, Rach. You're the strongest woman I know." She doesn't answer, but deep down she wonders how much strength she has left. In June 2018, Rachel suffers her third and most severe adrenal crisis. It begins with vomiting and dizziness, but within an hour she's incoherent. Mark calls 911. When paramedics arrive, her blood pressure is unreadable, her lips are blue, her pulse is weak. They inject hydrocortisone, start fluids, and race her to the hospital. In the ambulance, Mark holds her hand tightly, whispering through tears, "Don't leave me, Rachel. Please don't leave me." Her eyes flutter open just long enough to whisper, "Tell the kids I love them," before slipping under again. Hours later, she's in the ICU. Tubes, machines, the rhythmic beep of monitors fighting to keep her tethered to life. Dr. Warren stands outside the glass, watching the woman he'd come to admire more than any patient he'd ever had. He whispers, almost to himself, "You've come too far to fade away now." Hey, nurse chat! This is why adrenal crisis education is critical. Every patient with Addison's should have an emergency steroid injection kit, a medical ID bracelet, and a care plan their family understands. Most deaths from Addison's are preventable, if caught and treated in time. Rachel survives that night. Barely. When she wakes, she's weak but alive. Dr. Warren sits beside her, relief etched across his face. "You scared us again," he says softly. She manages a faint smile. "I'm good at that." He chuckles. "You really are." Then her expression changes, softer, more vulnerable. "Elijah," she whispers, "am I dying?" He hesitates. "Not today." Over the next few weeks, Rachel begins to regain her strength, slowly, painfully. But something inside her shifts. She stops focusing on what's wrong and starts focusing on what's left. She tells her followers online, open quote, "Maybe I can't control what my body does, but I can control what I do with the time I have," close quote. She begins speaking at health conferences, sharing her story to raise awareness about rare autoimmune diseases. Doctors invite her to talk to new residents to remind them what it feels like to be a patient unheard, unseen, and almost lost. Her message is simple, open quote, "Listen to your patients, especially the quiet ones, the ones who keep coming back with no answers. Sometimes the mystery isn't in their mind, it's in their blood," close quote. Hey, nurse chat. That's an important takeaway for all of us in healthcare. When a patient says something is wrong, believe them. Even when the tests are normal, even when the chart looks fine. Medicine isn't perfect, and sometimes rare diseases hide behind ordinary symptoms. It's October 2018 now. Rachel celebrates her 35th birthday, surrounded by her family. Her children make her a handmade card that reads, "Happy birthday, Mommy. You're our superhero." And for once, she feels it. Not like a patient, not like a survivor, but like a woman who fought back and won. She still takes her medications every day. She still wears her bracelet. She still lives carefully, but she's alive. And she's learned that survival in itself is a victory. As The Woman Who Faded Away comes to a close, 3 lessons remain. Lessons from Rachel's journey and from every patient who's ever had to fight to be believed. 1, your body is your truth. Don't let anyone silence it, not even those with the white coats and the degrees. 2, advocacy saves lives. Learn, ask questions, and demand answers, because early recognition of rare diseases like Addison's can mean the difference between crisis and survival. 3, compassion is medicine too. Whether you're a nurse, a doctor, or a loved one, your empathy can bring healing where medicine cannot. Thank you for watching all 3 parts of The Woman Who Faded Away. We hope Rachel's story has opened your eyes, touched your heart, and taught you something you'll never forget. Learn through the eyes of a nurse what you should do if you ever find yourself or someone you love in a similar situation. We look forward to sharing more powerful stories like this one. Thank you for tuning in to Last Breath Diaries. Remember to like, comment, share, and subscribe, and don't forget to turn on your notification bell so you don't miss our next medical mystery, where every heartbeat tells a story.